So hello guys, I'm Dr. Farzana and you're watching my channel Pharma Coach. So in today's Pharma Coach class, I'll be telling you about the ferrous sulphate drug, alright? और ये इन्फॉर्मेशन मैं आपको प्रैक्टिकल बेस्ड एक्सपीरियंस जो मेरा हॉस्पिटल में था उसके हिसाब से दूंगी. बिकॉज नो मैटर हाउ मच यू हैव लर्न फ्रॉम योर टेक्स्ट बुक्स, द लेक्चर्स इन क्लासरूम, द थिंग दैट मैटर द मोस्ट इज योर प्रैक्टिकल एक्सपीरियंस. I mean experience with your patients, because the exams, the textbooks and the lecture are not enough. So you got to be practical within your work. Okay guys, one more thing. प्रैक्टिकल एक्सपीरियंस के साथ जो मैं इंफॉर्मेशन आपको दूंगी वो यूएस नेशनल मेडिकल लाइब्रेरी से होगी. सो आप इस पे ट्रस्ट कर सकते हो बिकॉज वी नो दैट ऑथेंटिसिटी मैटर द मोस्ट. ओके, सो विदाउट फर्दर अड्यू लेट्स गेट स्टार्टेड. सो अगर प्रिपरेशंस की बात की जाए आयरन की, तो हमारे पास ferrous सल्फेट मौजूद है, ferrous fumerate अवेलेबल है और ferrous gluconate भी अवेलेबल है. और इनमें से ferrous सल्फेट टैबलेट फॉर्म, सस्टेन रिलीज टैबलेट और सिरप फॉर्म में आती है, जबकि ferrous fumarate और ferrous gluconate सिर्फ टैबलेट फॉर्म में आती हैं. These three preparations belong to category A. Therefore, these are safe in pregnancy. अगर मोड ऑफ एक्शन की बात की जाए तो आयरन कंबाइन विद पोरफायरिन एंड ग्लोबिन चेन्स टू फॉर्म हेमोग्लोबिन एंड इट करेक्ट द एरिथ्रोपोइटिक एबनॉर्मलिटीज़. ये एरिथ्रोपोइटिक एबनॉर्मलिटीज़ को भी करेक्ट करती है. अच्छा, एक और बात, ferrous सल्फेट जो है वो स्टिमुलेट नहीं करती एरिथ्रोपोइसिस को, बल्कि वो रॉ मटेरियल प्रोवाइड करती है इस प्रोसेस के होने के लिए. फॉर एग्जांपल, इफ़ वी हैव अ फैक्ट्री एंड वी वांट टू मेक अ प्रोडक्ट फ्रॉम द फैक्ट्री, so we need a raw material to make the products. The same case, these preparations provide the raw material for the formation of the blood. All right, now the uses. So these preparations are used in iron deficiency anemia. Therefore these are called anti-anemic drugs, also as prophylaxis in pregnancy and iron supplements in children. Now the contraindications, like the condition in which we can't prescribe these preparations. So number one, we have peptic ulcer disease, gastroenteritis, hemolytic anemia, hemochromatosis and hemosiderosis. अच्छा जी, gastroenteritis, hemochromatosis और hemosiderosis क्या है? Gastroenteritis, it means the inflammation of the stomach and intestine, and hemochromatosis, it is a hereditary disorder in which iron salts are deposited in the tissue, leading to liver damage, डायबिटिक मेलाइटिस. हेमोसिडरोसिस जो है ये ओवरलोडिंग हो जाती है आयरन की विद इन आवर बॉडी. एंड अदर कॉन्ट्राइंडिकेशंस आर लाइक पेशेंट ऑन रिपीटेड ट्रांसफ्यूजन एंड लिवर सिरोसिस. जो पेशेंट रिपीटेड ट्रांसफ्यूजन पे हैं और जिन पेशेंट को लिवर सिरोसिस है, उन पेशेंट्स को दीज प्रिपरेशंस जो हैं वो प्रिस्क्राइब नहीं की जाती. नाउ द ड्रग इंटरेक्शंस. ड्रग इंटरेक्शन की बात की जाए तो एंटासिड डिक्रीज करती हैं आयरन की एब्जॉर्प्शन को, and these preparation like iron preparations decrease the absorption of tetracycline. अगर सिप्रोफ्लॉक्सिसिन और सिप्रोफ्लॉक्सिसिन की बात की जाए तो ये डिक्रीज करती हैं इफेक्ट ऑफ आयरन. मोस्टली फूड डिक्रीज एब्जॉर्प्शन ऑफ आयरन. Vitamin C increase absorption of iron means we have to take citrus fruit when we are taking these supplements, because citrus fruit में vitamin C होता है. Now the protocol of this drug, which is the therapeutic drug monitoring, and this is what we the pharmacists are working for. So those patients who are taking these supplements are needing, like those patients जिन पेशेंट को हम जो है ये प्रिपरेशन देते हैं, उन पेशेंट्स की मॉनिटरिंग करना ज़रूरी है, लाइक मॉनिटरिंग ऑफ bowel movements like constipation and monthly checkup of the hemoglobin, and counsel those patients like not to take these supplements or these preparations with milk, coffee, egg and tea, and increase the vitamin C uptake like in the form of citrus fruit to increase the absorption of these preparations. From these three preparations like ferrous sulfate, ferrous fumarate and ferrous gluconate, our ferrous gluconate is a new preparation and it shows less gastric irritation as compared to the ferrous sulfate, and it's well tolerated within our body. And after 2 days of having this supplement, the patient feel well and good, and after 1 week the patient shows normal blood count. Now the dose and dosage according to the condition. For example, we have the ferrous sulfate. So in case of iron deficiency, ferrous sulfate, first of all, the ferrous sulfate is having 30% elemental iron, and the dose and dosage is like 700 mg to 1500 mg in a day, means within 24 hours. Then we give it in divided doses of 1 to 3 within 24 hours. Now the ferrous fumerate, which is having 33% elemental iron, and the dosage is like 200 mg, which we give in divided doses like 3 times in a day. Now the ferrous gluconate, which is having 12% elemental iron, and the dosage of ferrous gluconate is 325 to 600 mg, and we give it in divided dosage of 3 to 4 times per day. Now the ferrous sulphate in pregnancy. So in pregnancy, the dosage of ferrous sulphate is like 300 to 600 mg per day. Now the ferrous fumarate in pregnancy. So it is 200 mg per day. And then the ferrous gluconate in pregnancy. So it is 365 to 600 mg per day. Now the ferrous sulphate in child is a iron supplement, which is 300 mg per day. And the ferrous fumarate is like 100 to 300 mg per day, and the ferrous gluconate is like 200 mg per day. So now the administration. Food decrease absorption of these three preparations like ferrous sulphate, ferrous fumarate and ferrous gluconate. So take these drugs in empty stomach, and if the patient feels gastric irritation, so give gastric gluconate, which causes less gastric irritation. And remember, ferrous sulphate causes more gastric irritation as compared to others. So take this after food with plenty of water, because water is a buffer. And don't crush the tablet. Don't give this within 1 hour of bed. Ferrous sulphate syrup causes discoloration of teeth in children. So wash your mouth immediately after having this. Now the adverse effect. It causes nausea, heartburn, constipation, black stool, brown discoloration or yellow-brown discoloration of teeth. It causes rickets in children if used for a long time, because iron decreases the absorption of phosphate, result in deposition of phosphate in bone get decreased. Now the elimination. Elimination occurs through the nails, hairs, skin and GI mucosa. And iron absorption from intestine occurs 10%. And after having this supplement, it goes to like 30 to 40%. So that was all about today's lecture, and if you like my videos, so do like and subscribe my channel, and thanks for now.